A patient has expressed some curiosity, sir. And could you please tell us something about gallbladder stones? When the atones occur, what kind of symptoms do they present? And for its examination, what tests should be performed?
And what is its treatment in homeopathy? And other such questions have been raised. First and foremost, we need to understand how stones are formed in the gallbladder.
Many studies haven't been able to definitively state that stones are caused by this particular reason. However, among some potential causes, for instance, when an excessive amount of cholesterol builds up in the gallbladder, and the bile then cannot properly digest this formed cholesterol, whether due to saturation or its inability to re-emulsify it, then it begins to accumulate into small particles. Ultimately, it is said that these particles form into stones. Another factor is when there's an excessive amount of bile in the gallbladder. When this excess bile doesn't empty out completely, its concentration gets disturbed. And because of this, the concept is that it eventually takes the form of a stone. That then becomes another risk factor.
In terms of risk factors, we often refer to something called the 5Fs. The 5Fs really stands for example, a female, then being 40 years old, next being fertile, and finally being fatty.
It is said that this condition is more prevalent in individuals who fit the 5Fs criteria. Specifically, female sana indicates that it is observed more frequently in women when compared to their male counterparts. Likewise, 40 signifies that it tends to affect individuals more often when they are in their 40s or around that age. And fertile implies it is more commonly found in ladies who have had 3 or 4 children.
Another thing, again, is that it's said to be more prevalent in people with European American skin types than in those with African skin types. Another concept is fatty. Maso andali. Yeah, it's more common in slightly overweight or larger individuals compared to thin people. So
now, when we discuss its symptoms, the symptoms often include somewhat sharp stabbing pain in the upper right side of the abdomen. And sometimes this pain can also be felt in the upper central part of the stomach. Some patients also experience nausea and may even vomit. Besides these, there are gastric-like symptoms such as a feeling of bloating in the stomach, and symptoms like acid reflux, bloating, and nausea are observed. And if the stone has taken a more complex form, the patient develops a fever with chills, then the pain becomes more intense, and so on. And then there's the question of what tests to perform.
For tests generally, a CBC is taken. And then an X-ray and a CT scan are performed, and then an ultrasound is done. And if there's any suspicion of a liver or gallbladder issue, then a liver function test or an ERCP can be performed.
So, what is the homeopathic treatment for this condition? You might wonder. In homeopathy, even though this is considered a purely surgical case, if despite the presence of stones, the patient experiences no significant discomfort or unease, and no indications of complicated issues or severe symptoms are observed, then we administer medication designed to prevent the stone's size from increasing.